Hello everyone. Today I am going to discuss medical textiles, which is part of technical textiles for M.Tech students. In this chapter, I will discuss introduction, requirements, fibers for medical use, absorbency, sterilization, wound care, sutures, vascular grafts, and references. First of all, introduction. Textiles are no more limited for use in apparels. Clothing is just one, but not the only purpose of textiles. With the rapid changes in the socio-economic structure of our society, medical textile is an important and growing part of technical textiles. Medical textile has achieved a significant growth in the recent times thanks to constant improvements and innovations in both textile technology and medical procedures. Although a wide range of textile products have been in regular use in medical and surgical areas since many years, new applications are still being explored and identified with the advent of new fibers and researches on manufacturing technologies for yarns and fabrics. Development of medical textiles can be considered as one such development which is really meant for converting the painful days of patients into comfortable days. Textiles are used in different ways in medical science, like sheets used for operating, hospital bedding, medical cushions, clothing for doctors and nurses, suturing and bandage material, new prosthetic and non-allergic devices like artificial kidneys, heart, membranes, blood vessels, etc. Moreover, these textile materials are used in different forms like fibers, yarns, 3D woven and knitted fabrics, and non-wovens. So, like the developed countries, there is a great growth potential in this sector in India also. Now, requirements for medical textiles. The textile material suitable for any medical or surgical application require a combination of strength and flexibility apart from elasticity and moisture, air permeability. The textile used for medical purposes should meet the following requirements: acceptable composition purity. It should be free from all types of impurities and surface contaminants such as lubricants and sizing agents. Non-toxicity. The fibrous polymer must not release toxic substances. Then non-allergenicity. It should not be allergic. Non-carcinogenicity. It should not have substance that generate cancer in body. It should be able to be sterilized and minimum or no change in chemical and physical properties. It should retain its tensile properties. It should not exhibit any untoward effect on properties of the blood and should not damage the tissues. It should have good resistance to acids, alkali, and microorganisms. It should have good dimension stability. It should be biocompatible and should have minimum level of tensile strength, elasticity, resilience, and fatigue endurance. Now, fibers for medical use. Already, natural fibers like cotton, silk, and synthetic fibers like polyester and polyamide have been widely used. But nowadays, many specialty fibers have been developed like polytetrafluoroethylene, PTFE, polypropylene, glass fiber, carbon fiber, collagen, alginate, chitin, chitosan, and PVA fibers also have been found to be suitable as modern wound dressing or other related medical products. Calcium alginate fibers are formed from metallic salt of an alginic acid, a natural polymer occurring in seaweeds. Because of their high absorbency properties, good moisture retention, and healing properties, alginate fibers have been widely used in wound dressing, which are hemostatic, non-toxic, biodegradable. They are used in dental surgery, also in plugging cavities. Collagen, which is obtained from bovine skin, is a protein available in either fibers or gelatin form. When collagen is cross-linked in 5 to 10% aqueous solution, the resultant transparent hydrogel formed has high oxygen permeability and can be processed into soft contact lenses. Chitin, a polysaccharide fiber obtained from crab and sailfish waste, has excellent anti-thrombogenic characteristics. It can be absorbed by the body and promote healing. Chitin non-woven fabrics used as artificial skin adhered to the body, simulating new skin formation, which accelerates healing rate and reduce pain. So it's a uh, best example to be used as artificial skin. Treatment of chitin with alkali yields chitosan, which can be spun into filaments. Chitosan is also being developed for slow drug releasing membrane. Chitosan takes direct action on microorganisms and destroys their physiological functions. Polycaprolactone and polypropylactone fibers can be mixed with cellulosic fibers to produce highly flexible and inexpensive biodegradable non-woven fabrics. Melt spun fibers made from lactic acid have similar strength and heat properties to nylon and other biodegradables. Biomedical products using polyurethane include bladers for artificial heart, catheters, and films to encapsulate the gaze of stick resistance surgical dressing and water extractors for density. Use of polysaccharide dressings has become increasingly popular against cotton and viscose gauges. Another recent development is the biomedical application of biocomponent fibers. Biocomponent fibers help to achieve good mechanical strength. Scientists have found a way to mimic spider's silk and spin it in industrial quantities by genetically engineering spider genes into a herd of goats. Spider silk is 5 times stronger than steel and far more elastic than rubber. Nexia Biotechnologies of Montreal has now moved towards commercial development of multiple applications such as medical sutures, biodegradable fishing lines, soft body armor, and unique material composites. So with this I would stop here today, and in my next video lecture I would discuss classification of medical textiles, uh, biodegradable and non-biodegradable fibers, and also implantable and non-implantable materials. Thank you very much.